So we have gone through two objectives in this module. This is the third objective of the module, and we really want to focus on the network. We want to take a look at what is happening in that box 1 that was in that top left-hand corner where the network existed. So we know, at least I hope we do, that benefit planners, Fortis Insurance Company, employee benefit consultants, Pacific Life and Annuity, those are not places you hold contracts. Those are the TPA. The TPA uses the insurance group's checking account funds to pay the health insurance claims at the contracted network rates you signed. So let's take a look at this. Fortis uses PHCS, no problem. We know we're getting paid the $100 from PHCS for our service. But look at Megalife. Megalife has access to PHCS's network, and they also have access to Beach Street's network. If PHCS's contract pays me $100, and the same service Beach Street pays me $50, Megalife knows this because they have access to both contract rates for me as a nurse practitioner in those clinics or in those networks. So Megalife gets a claim from you for services. I'm going to be chunking along on my computer and I'm going to look up and go, oh, $100. Ooh, wait, I have access to the Beach Street network. I'll just pay him $50. Perfect, done. I get paid 100% of savings. You got paid $50. I'm great. You process it through. Your business office didn't have a clue. All you know is you got paid. But when registration occurred and you did real-time eligibility and you verified insurance and coverage, you should have a Megalife and Health / PHCS insurance group and a Megalife and Health / Beach Street to designate the network, because when you look at the insurance card, it didn't have Beach Street on it, it had PHCS. Megalife just discount brokered you to a lower reimbursement because they could. When reality is that a claim needs to be appealed and say, patient presented as Megalife is a third-party administrator, PHCS is the network, I expected $100, you paid me $50, I want my extra $50. But how many practices have the depth to know that's what happened? You do now because you understand some pieces of the network. Isn't this exciting? Okay, so moving on. Let's take a look now at some other little scenarios. So Evergreen Health, they're the network. Look at the top right up here. They're the network. They're also the insurance code risk. They're medical management and third-party administrator. By God, that screams health plan. So wait, why is there a PHCS logo on the card? Now I'm really confused. No, stop and think for a minute. Evergreen Health is a geographically sensitive health plan, let's say in Camden, New Jersey. But when you leave Camden, New Jersey, and you decide you want to go to Alaska, Camden, New Jersey's Evergreen Health Plan did not go to Alaska and contract with the hospital you went to visit when you were up there and fell off an iceberg. So what Evergreen does is said, hey, we need to buy an access to a RAP network so that when you're in our geographic area, you should be paid Evergreen rates. But for me to get access to anybody you may see in the country, I need to buy access to a RAP network, which is PHCS. So the admissions office at the hospital in Anchorage, Alaska, looks at the ID card and they're going to say, Evergreen Health, we never even heard of that. But they're going to see PHCS and go, oh yeah, we have a contract with them. That's one of the national PPOs. We get that. Hey, I expect to get paid $100. So the claim goes through, processes. Evergreen Health should pay at the PHCS contracted rate, $100. Now, is this an Evergreen Health patient to Anchorage, Alaska's hospital, or has this become now a PHCS patient? It is a PHCS patient because that's the network that hospital was discounted their services to. It is not Evergreen Health, and by God, let's not create 19 other million insurance companies because that's not the right area. So what's a stacked network? Well, wait a second. Megalife had access to PHCS, paid me $100, had access to Beach Street, paid me $50. Every time a claim goes to Megalife, they pay me $50, so I just expect that's what I'd get paid. No, they have a stacked network. They're using the two networks, paying you the lower of the two networks, called discount brokering, and you're getting paid the lower of the two because nobody's paying attention to the ID card. Folks, Look at the ID card, look at the logos. You've got to capture that information in your practice management system so you know where is the discount and what is it you should be expecting to get paid. And when you don't get paid that, appeal it. This is games of ways the insurance companies and these networks and the insurance companies buying access to these networks discount your services. Remember, they want their buckets full. Then you have what's called a silent network. And a silent network is when the Anchorage, Alaska hospital looked at this insurance card that had Evergreen, had PHCS, said, yep, we're in neither of those. By golly, you're here. Maybe we got authorization to treat you. That was really cool. So we got that box checked. But I expect almost full bill charges because there is no discount that I have agreed to for which I am going to see that patient. But wait, all of a sudden a silent network came in and I get an EOB back that says, hey, PPO discount taken. And I'm going to say, what PPO discount? I don't have a contract with Evergreen Health. I don't have a contract with PHCS. What on earth are you talking about? So you pick up the phone, you call the health plan and say, I'm sorry, what PPO discount could have you possibly taken? And they say, oh yeah, you have a contract with MultiPlan. We bought access to MultiPlan and we discounted your services. Guess what, folks? You're not allowed to do that. But wait, how many people picked up the phone and said, hey, I'm confused. Why did I get this PPO discount? They're such processors. They just whipped this stuff through, took the discount, moved on, and saw the next patient. You got to know what's going on around you. See all the ways doctors can lose money and nurse practitioners who don't understand this stuff can lose money? Now, some states prohibit silent networks, thank God. But I worked for a company where the silent network we used all the time in that scenario with Anchorage, Alaska, where the provider, we looked at the claim and said, oh my God, we've got to come up with a discount somewhere. Let's just grab a network, paid access to it, got the discount, paid the claim, and if that provider wasn't on top of their game, they would have never known. That's how health plans use networks to make money. Now, a wrap networks benefits you because otherwise, that Evergreen Health patient would be out of network. They get out of network benefits, but because it's a wrap network, they got in-network benefits to see you. Okay? Isn't this crazy how this stuff works? All right. So here is just a sampling of the networks that exist. So let's think. New practice, coming into a market. Do I want to contract with every one of these networks? Well, of course you don't. One, because they'll discount broker you. Two, you want to be selective and make sure you have the reimbursement threshold, because if I never wanted to get paid $50, I don't know why I ever accepted that Beach Street contract for $50, because if 100 is the lowest I'm going to go, don't sign a network contract just to get access, because you just saw on the last slide ways they manipulate those contracts to discount your services, and many times that business office isn't even clued in, have any sense of what's going on. They're submitting charges, they're posting payments, they're working these receivables, and they're just telling you what their performance numbers are. But you're not getting the most money. So, got to think of a strategy. Well, it all comes back to, let's look at the employers. Well, here's the networks, here's my employers. Perfect. I know who's who. Cooper University Healthcare. They're on AmeriHealth, New Jersey. Solid. I know exactly what's going on with them. This is a great day for me. I got Rowan University. I've got United Healthcare. Oh, wait, what's this United Healthcare multi-plan? Oh, that's a wrap network scenario. I know that United Airlines is under Blue Cross Blue Shield of Texas because Houston used to be Continental. All right, I'm in good shape. But wait a second. How much do these pay? This is where we get into a bit of what's called target marketing. So, new office visit, $129.40. So, my Bass Pro Shop employee, when they come to see me in my nurse practitioner clinic, pays me $129.40. That's my allowable rate. That's pretty awesome. Wait, when grandma comes in, Medicare, come down a little bit on the chart, it's $94.45. Well, wait a second. I don't know if I want to see grandma. I want to see more Bass Pro Shops. Here's the point. When you know what you're getting paid on those network contracts, remember, these are the employers, my consumer. If I go back, wait, what's Bass Pro Shops mean? That means I have an employer's health network. Bass Pro Shops is using employer's health network. Ah, got it. So, Bass Pro Shops pays me $129. Grandma, Medicare, pays me $94.45. And if I worked for the Houston Independent School District, I get $94.47. Oh, wait, a few dollars more. That's pretty cool. Now when I start looking at this, do I want to open up a health fair, go to the mall, and try to recruit patients? Do I want to stand outside Walmart and recruit patients, or stand outside of a grocery store and whoever comes up just try to recruit patients? Oh my gosh, no. You absolutely do not. You want to look at a profile like this and go, all right, Ducky Bob's Party Rental employees, Bass Pro Shop employees, that's where I'm hanging out. I am going to hang out at Houston Baptist University, and I'm going to check every one of those employees and teachers and professors that walk out of that place. I want them to be my patient. Why? Because do I want to get paid $63.88 for the Southwest Lincoln Mercury employees that are going to see me? Or do I want the Bass Pro Shop employee for the exact same service is going to pay me $129.40? Target marketing. You are targeting the employers in your market based on what? Your network contracts to know this is what I want. This is when you get to the meat of the game. The meat that says, hey, I want to grab every pregnant female at Bass Pro Shops and deliver that baby because my delivery reimbursement rates, based on what you can see just here, are going to be greater and more beneficial than if I try to deliver a Southwest Lincoln Mercury pregnant female. Because that's the kind of reimbursement you look at. When you get to this detailed level, now all of a sudden you're in control. You're in control, you're managing the network, you're controlling the access of what's going on in the networks, and you know what? Let's go back all the way to objective number 1 in this module, where I said, did the factory workers change health plans? Guarantee you, if I can get my Bass Pro Shop employees in my practice, I'm going to know when they're going to change their insurance plan, and when their insurances decide, hey, we're going to change insurances and we're going to not use Employers Health Network here at the top anymore, but we're going to come down and use maybe HealthSmart or PPO Next. Whoa, wait a second. That's an impact to my financial management of my healthcare practice. This creates an issue for me, and you want to be proactive in addressing it. Now, this section I am very interested to hear about on the discussion group, and here's why. 1, it's very confusing. I hope I didn't lose anybody. If I lost anyone, I'm going to represent this in some other fashion, because this is the guts of the whole thing when you think about it's a network. And Blue Cross Blue Shield of Texas, wait, they're an insurance company. They're also the medical management piece. That Blue Cross Blue Shield of Texas piece right there, that is... And I'm going to go back up here. You might have this slide right here. That is the Blue Cross Blue Shield in each scenario. But remember, we're dealing with the network piece of that puzzle, or that health plan. Okay? So, can't wait to hear what your thoughts were on this piece and understanding this component of it. I think, I can't have the end of the slideshow. Where's my... I lost the slide on the last thing. So besides going back and reintroducing, I think our last objective was that we were going to look at how networks benefit and hurt us. They benefit us because wrap networks can bring us new patients on an ID card where we may not be with Evergreen Health, but at the same time, a stacked network can discount broker us if we don't have our act together in our shop to avoid this relationship right here of this PHCS Beach Street Mega Life discount brokering on us. And why is all of this occurring? This is all occurring because we have 4 pieces of the puzzle, and we're always trying to manage these 4 pieces of the puzzle. And what are we always trying to do? We're trying to always make sure these buckets stay full of money. So, a little bit about the healthcare dollar there. I hope this has been like eye-opening, or at least something beneficial, and I look forward to hearing your comments in the discussion group. And thanks so much, and I'm getting ready for our next module.